So the easy part is understanding how to do an evaluation, use the instruments, the modalities, the exercise equipment. The hardest part really is understanding how to write a proper note for reimbursement. And then the other parts are, make sure you know how to use the machine, the administrative procedures that occur in a clinic. You have to focus a lot on customer service because you have to make sure your clients want to come back. Not everybody wants to make their copay or high deductibles or go through therapy, so part of it is customer service. And then work with patients. We daily in a routine, we're helping them get in and out of their cars, in and out of the bathrooms, things you wouldn't think you would do, that you do, and every day you do with a smile on your face. So you have, you work in a hospital, and there's multiple positions in a hospital. You could be bedside, in acute gyms. They have outpatient gyms, specialty floors for neuro, for stroke patients. So there's a multitude of spaces or places within a hospital to work. We have home health care you could do, nursing homes you work at, VA administrative homes you work at, and then outpatient clinics. And in outpatient clinics, we have all kinds of things, from pools to Pilates to traditional orthopedic physical therapy to industrial medicine. We're doing a lot of job testing, working with plants and injured workers. So there's a multitude of fields you work in. So speaking for an outpatient clinic, typically our hours are 8 to 5, Monday through Friday is when the clinic's open technically. But we typically are in there early to get things started. And then 2 or 3 days a week, we may actually be there an extra hour after work, just catching up on notes, making sure we're prepped for the following day. Traditionally, we're closed 12 to 1. But once again, you develop relationship with patients where we're seeing them maybe into lunch a little bit. We're coming in early to see a patient, just assess someone before they're going back to the doctor. So 8 to 5 may be your core hours, but you can plan. I'm probably working 46 to 50 hours a week most times. Let's see, licensure. I guess once you graduate from school, you have to apply to take your board exam, and after reaching a maximum score, then you'll be a licensed physical therapist. While you're waiting to take your exam and get your scores in, you'll work directly one-on-one with a physical therapist. They're going to supervise your program, help guide you through the care of the patients, and make sure you cause no harm. So specializations are broken down to, I like to say, 2 different areas. One that are recognized by the APTA, and then those others that you can achieve by going through programs. So most of our manual therapy programs are all outside the APTA. You can get specialties in manual therapy through St. Augustine, through the OGI programs, through Evidence in Motion, and you get some initials that go behind your names, signifying that you're manual therapy certified. But the APTA has recognized programs that follow a pretty formatted routine, and those are in orthopedics, in sports, in geriatrics, respiratory, and there's new ones coming on the horizon in oncology and in occupational medicine. We'll have some specialties coming in the future. So I suggest that you look hard at the ones that the APTA have recognized, because those will be the ones that we'll start promoting more in the future. I would tell them, if they could focus on a degree that they may be able to use if they didn't get into PT school. So some kind of collateral degree that could start working in the meantime. Also do some shadowing in the different areas of physical therapy, just to make sure they want to get into this field. So the one, to do a lot of shadowing, and the second, to focus on a degree that they could use if they don't get into physical therapy school. So after this last year, in talking to some of the students who graduated, I think the hospitals were starting mostly between 68 plus up to about 70, 71. The outpatient clinics were doing more 72 to 75. A lot of people weren't jumping right into home health just yet, but I know they're still paying $60, $65 an hour for seeing patients. And then if you're doing some traveling physical therapy, that seems to be paying roughly around the same rate, probably 55 to 60 bucks an hour. Well, we interact with some OT, with some athletic trainers who work at the schools. So as their athletes are getting hurt, they kind of flow into us and we flow back with their patients. We deal a lot with physician assistants, doctors' assistants, or their nurses. So interacting with them to make sure the proper care is happening also. I think a lot of patients, we hear the story often, is they didn't realize they could come to us directly. They always feel like they have to see the physician first, even though they know they don't want surgery, injections, and they really don't want medicines. A lot of people just don't realize they still could come to us and ask us questions about, do we think they have a sprain, a broken bone, do they need therapy, what kind of things they can do to help fix their problems. The future is bright for physical therapy. I think as we do more of the movement science behind physical therapy, as physical therapists' roles expand with direct access, being frontline providers for health care, especially musculoskeletal health care. I think the future is bright. The things that give us the most concern is always going to be reimbursements. Medical costs in the United States is very high and a large part of the gross national product. So they're always looking for ways of cutting costs, shorten amount of visits, meanwhile providing more care and more avenues of care. So we have to be more creative. We have to start thinking more outside the box. It's not going to be the old traditional physical therapy, but I think the future is bright for us. I think the best thing about it is just meeting a whole variety of different people from all walks of life, all different experiences. You get to learn so much from people, see them get better and moving on, or if they're not even progressing, helping direct them to the right proper care. That's just as rewarding as making them better. The hardest thing is really just keeping up with the paperwork. And you really don't look at it as the hardest thing. If it's the part that helps us get paid, that's just part of the job. So just keep up with the paperwork. It's not the most glamorous. You'd rather be out in the clinic. That's what we do for a living. But the paperwork is just essential. So the more you accept it and get on board with it, the easier it is.